Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can be profitable and successful for years to come. This week on the Edge Podcast, I'm excited to invite Donna White. She's the principal consultant and owner of Legacy Consulting Services and Legacy Billing Solutions in Montgomery, Alabama. Her expertise, refined through almost 3 decades working in the healthcare field, includes revenue cycle management, healthcare consulting, leadership development, medical billing and coding, dental billing and collections, data analytics, HIPAA training, policy and procedure development, training and management, you name it, she's your gal. Donna's passion is making office operations and companies more efficient and improving the bottom line. She excels in analysis, contracting, revenue cycle management, and business development strategies. Donna, welcome to the program.
Thanks so much, Terry. I'm very excited to be here today. Super excited about this topic as well.
Yeah, me too. I think this topic, I know that a couple of years ago, because the podcast's been out for about 3 years, I know I talked about it before, but I don't think we really kind of got into depth. And now with how far we are into digital means and a lot of, outsourced and in-house billing, which is what we're going to kind of dive into. There's a lot of people working remote, more so than 3 years ago. And I know COVID had a lot to do with it, but I wanted to just really reach out to you and get your expertise and your insights for medical practices when they are deciding between in-house versus outsourced coding and billing, what that, involves. I know we have to kind of weigh cost, control, and expertise. Is there, outsource? Everyone always says there's cost savings and access to specialized knowledge can improve efficiency, but I have a problem losing control of in-house billing and direct access to staff. But again, there's pros and cons, and I just wanted to kind of dive into that topic and see what your thoughts are. So why don't we start, and you tell me, let's start about the pros and cons of in-house, keeping it in-house.
Certainly. Well, there definitely are some pros to keeping it in-house, and a couple of those you've mentioned already. One is direct control. You actually have, obviously, the ability to oversee the staff, the workflows, and everything that takes place within the revenue cycle and billing process. The other pro that we find is you have access to the team. There's sometimes considered to be faster resolution to internal questions or issues because you have that immediate communication. Or even, for example, if a claim gets rejected or denied, maybe the team can handle it right on the spot there. So there are, some of those types of pros, but on the con side, I think that staffing is definitely a problem. Finding and keeping skilled revenue cycle team members can be tough. And certainly, as you and I both know, keeping up to date on all of the payer changes and regulatory changes that take place, both from a reimbursement perspective as well as just overall payer guidelines with authorizations and things like that. And I guess just to mention a couple of other cons, one of the main things we find is whether it's a small or a large practice, oftentimes there's a lack of oversight, or maybe it's the same team member that's handling the front office as well as scheduling, and maybe things are not being proactively monitored, and the staff is not being held accountable for the billing pieces. So those are some of the challenges, or maybe there's no key performance indicators that are in place to really track how things are going.
Well, and I noticed that a lot of the providers, because I get this question all the time, should I keep it in, should I keep it out? And obviously the first thing, we both have to do is assess the size of their practice, what their staffing, situation is, how many providers they have, and ongoing, assessments. But I don't think a lot of the providers understand that when you outsource, not that this is a negative, but it is something to consider. A lot of the outsourced companies, they're billing companies. They don't just take care of your practice. And when it's in-house, it's just about your practice. So how do you explain that that's why they're getting the discount or the not having to, pay for salaries and retirement plans and benefits and things versus a percentage of either, what's billed or collected.
Yeah, since most of the outsourced billing agreements are based on a percentage of collections, they're really incentivized to collect every dollar that's left on the table.
Right.
Working all denials, all rejections, everything that is aging in any bucket. Whereas maybe, the internal staff, as you said, you're paying for the wages, the technology, the space, as well as the benefits, and so that those costs can add up. And then goodness forbid, if you do have turnover and you've got to retrain, those costs can be extremely expensive as well. And it's not to say that outsourced billing is always going to be cheaper, but what we do find from an ROI perspective, when we look at, let's say we go in and do a revenue cycle assessment before we take over billing, or we do a billing integrity audit of some sort, we typically find anywhere from 5 to 8% of the money that could be coming into the practice is being left on the table. And many times it's even upwards of 10 to 15%.
Wow.
So that's money that's not coming in the door for the providers that's being left. It's either being written off or potentially just underpaid or uncollected altogether. So when you start to look at it that way, you can quickly see that the outsourcing could, in a sense, pay for itself, so to speak, when you consider all those variables.
Now, when you make the recommendation to a provider saying, it would really be cost prohibitive to keep it in-house versus it would be better for you to outsource, let's say you did have a provider or a practice that was the case, are you the one that vets the billing company that you refer them to, or do you let them find one? The reason I ask is because I've noticed lately, and I find it interesting, because I had a billing company in the 80s and 90s, and I sold it. And like you said, we worked the denials, we worked, the billing, the collections, all that. And I'm noticing more and more billing companies don't work them. They just basically are data entry and spit out people. And it's interesting to me that that's the case. I was like, why aren't you working this? And they send the denials back to the office who didn't even have any part in submitting the claim.
Right. Unfortunately, there is a lot of competition in the outsourced world right now. There are a lot of practice management software vendors that are also offering revenue cycle or medical billing, outsourcing. And it's not to say anything negative against them whatsoever, but oftentimes they are going after just this, what we call the easy money.
Yeah.
It's billing the claims and maybe working the rejections, but not working on the denials and the appeals, the more difficult claims that oftentimes, again, represents 10 to 15% of the money that's being left out there. And so you might find a company, I'll just throw this out for example, that's, let's say it's just a family practice group of maybe 5 providers, and they are getting a quote for, let's say, 4 to 5% of collections. And maybe there's another company that's going to do the same services, but at 6 to 7%. And they want to understand, well, why is one, so much higher than another? And I think that's really where you have to evaluate, what are they doing? Like you said, are they just working the easy dollars and just sending the claims and working the rejections? So they're really going after the hard money to collect and making sure that practice is getting every dollar that they're owed. So those are some of the things that are really important to evaluate. And yes, we absolutely help practices evaluate different vendors. Of course, we provide medical billing services as well, but by no means are we the only game out there, and we want them to get what's best for them. There's also the option of a hybrid approach. Maybe you're just taking on just the old AR, or maybe the harder claims to collect, and they handle all their billing. So there's a lot of, their upfront billing, I should say. There's a lot of different ways, I guess, to go about it in a more customized approach, even if it is a hybrid approach where some of it's handled in-house and some of it's being outsourced.
Yeah, and it's interesting because, and again, it sounds like I'm giving all the cons for outsource, but since I have a membership of coding and billing and people can ask questions through my membership, a lot of times I will get an outsourced billing company that'll say, we want to join your membership because we just got a new client. Let's just throw it out there, the cardiology, and we don't have experience in that specialty. And I'm not laughing because it's funny. I'm laughing because it's absurd. And,
Yeah,
and they're
yeah.
like, so we need your expertise for questions and billing. I'm like, you've got to be kidding me. Did you tell that provider or that practice that you know nothing about their specialty? I mean, it's frightening to me. And they're like, well, we are on a couple of, social media accounts and we get our information from that. I'm like, so you're getting
Mhm.
your coding on Facebook? I mean, it's frightening to me sometimes. Or I've had, outsourced billing that's not in this country and they don't understand some of the privacy protections or situations there, and access is tough. And they don't have also the protections for cybersecurity and things. I'm not saying they don't, you don't run into that in the US, but we have more safeguards on that here.
Yes,
So it's interesting when I see the outsource where I think some practices are only looking at the percentage, but
yes.
as you said, they're not looking at the big picture.
Absolutely, no doubt about it whatsoever. And I think, unfortunately, many times they don't know all of the questions to ask when they're vetting a billing company, and that's all they're looking at is the percentage.
And so how do you, I guess, because I mean, if you were vetting a company, I definitely would want to refer to you. How would you say, okay, if you're going to look at outsourcing, do you discourage a company that's out of country? Because we actually have a member, Vinny, and he is awesome, and he facilitates. He's kind of like a brokerage firm for a bunch of outsourced billing companies. But his company that does that, they vet everyone that's in India or in a different country, and make sure that they follow U.S. rules. Because and he told me how it works for him, but not every company's like that.
That's so
And
true.
yeah, so how do you deal with that when you see the out of country, outsourced charging 2 to 3%, and then you're seeing U.S. based outsourcing charging 5 to 6% without making it about where it is.
Yes. So I've worked with a lot of overseas revenue cycle and medical billing companies. And, of course, they have a lot of value to add in a lot of different ways. But I think, again, the vetting is really important. What we typically suggest is let us, look at your AR, do some sort of, again, whether it's a revenue cycle assessment or a billing integrity audit. And oftentimes we will go in somewhat transparently so that really the internal team as well as the outsourced team is not so much aware of that, but we will look at all the key metrics that we as a medical billing company would have in place for our clients. And we did this recently for two companies, and unfortunately the results were staggering. I'll say at least at
Yeah.
best, they were staggering what we found. There was so much that was written off. And so I think going through that process, I mean, what does that even look like? I mean, it's
Right.
really looking at all the key metrics, your aging, your DSO, your denials, how are denials trending, looking at your write-offs or things written off that should not have been, were they billed and coded properly? Does the documentation, and it spills over into what you do, Terry, with, chart audits and things like that, because
Mhm.
there's so many aspects of this that if if you're not working hand in hand, let's say whether it's multiple vendors or again an internal team, if you don't have your eyes on the ball for all of those different areas, things can quickly derail and you're losing money and you don't even know it. And so
Yeah.
that's really where we would focus, is really trying to vet all of those different areas and just see, are they leaving money on the table, or are they writing off things they shouldn't be?
Well, and I think that's also one of the pros and cons, probably, as far as keeping it in-house versus outsourcing, is that you can have policies of what actually is appropriate to write off versus what you go after. An example that I had just come up this morning was one of my clients. He said, can you look at these 40 reports? It was interventional procedures for the heart. And he says, we're just not getting paid on them. He goes, we're getting paid for our heart cath, but not for our interventions like stents, angioplasty, etc. So it took me 10 minutes. And I could see it right away where the person that was submitting the claims, or coding, I should say, they were coding unspecified diagnoses for patients who had acute myocardial infarctions when on the actual reports, it gave a specified artery. And so using,
Right.
unspecified versus basically saying it was the inferior right coronary. And I said, it's right here. You're using, to 1.3 instead of I2 1.11. I said, I don't understand. Even this is something you might, it's again, not funny, haha, just funny, like, really? The code was on the report and they missed it. And so, and that was actually internal. And so it's not everything as far as, 'cause I just want to make sure everybody knows, we're not just saying don't do external, just you have to have some controls, but you also have to have them internally to see what the staff's doing and make sure that they are versed in coding and billing for your specialty, that they understand what they're looking for. And Don, I don't know about you, but sometimes I do see some, I don't know how to say it, general coders or generic coders that may be certified, but they don't have that specialty piece. Do you see
Yes.
that? Yeah.
Oh, absolutely. Very much so.
Yeah. And that's tough. So moving on a little bit, now one of the things that, concerns me is that during COVID, and the shutdown and the pandemic, we had a lot of people pivot to remote, even obviously even staff, billing staff, internally and in-house. And I noticed that nobody really took the time to make sure that their computers were HIPAA protected, they were cybersecurity protected. A lot of people were using their home computers and desktops, and there's not locked cabinets in their house if they have any paperwork. How does that work in your consulting? Do you address that and cybersecurity for the remote workers if they decide to keep it in-house?
Yes, absolutely. If they decide to keep it in-house and they're going to use a remote biller, we do run through all of those things, both, everything from email as well as, their security policies, everything from a compliance perspective, HIPAA training, just all of those aspects, because it is critical. And as you said, with an outsourced company, the same thing applies. I mean, obviously there's some things that for an outsourced company, if they have cyber breach insurance, that, they should have to prove all of those things. But, those are oftentimes questions that are missed as well when, a practice might be vetting an outsourced company. And it's really important. I mean, it truly is. Using their home computer to work for a billing company. Of course, I would never suggest that. I think it should always be a dedicated computer by all means.
Right.
And it should have all of the security, protocols and encryption and everything that's required. I mean, that's sort of just a must in today's world with all of the data breaches that we have.
Yeah, and it's not if you get a data breach. Just think change healthcare.
Exactly.
It's when, I mean, that United Healthcare debacle is still going on with people trying to, dig themselves out of that.
And I
So
will say real quickly, I do
yeah,
think having remote workers opens the pool of skilled workers
it
much
does.
more. So there are some definite pros to an outsourced company or an in-house, biller that might work remotely as well, because it just opens up the pool of candidates so greatly. But there's definitely a lot of due diligence that's involved there.
Right. And when you have remote workers, just to our listeners, and this is in anything, not just the revenue cycle management, you have to have a way to, and again, not micromanage, but to make sure you are managing. Just like you'd manage them in person, you have to be able to manage remote workers as well. So just to kind of wrap up the topic, what would the top five things would you, if somebody came to you and said, I need help and assistance in figuring out if I should outsource or keep my billing in-house, what are the five things you need to know from them before you can really make an assessment?
If they are undecided, oftentimes we would propose a limited revenue cycle assessment or billing integrity audit, which really can go hand in hand. Let us spend, 5 to 8 hours, let's say, looking at your revenue cycle, see where there's, gaps or leaks or breaks in processes, and or where things, have gone, down the wrong path as far as your aging goes, let us look at that, and then we can come back to you and we can make recommendations for, okay, let's go ahead and keep it in house and let us do maybe a monthly AR review with you for the next 6 months, and let's see how it goes. And if after 3 to 6 months you're not seeing improvement and the metrics are not where they should be, then maybe at that point we consider outsourcing. But that's typically what we would recommend. Now, if they are really wanting to outsource because they're just, fed up, then at that point we would send them a checklist of items to make, because obviously we want it to be a win-win. And this would be true no matter who they're outsourcing it to. It needs to be the right fit. It needs to be the right partnership, so to speak. And if they are really wanting to control things and they're not wanting to be hands off at all versus they're just done with it, that obviously is one key indicator to us as well. But what else can I elaborate on, Terry?
It sounds like you get a lot of providers that come to you and say, "I'm done with it."
We do. There are people to the point of
Just
they
take
know.
it. Yeah,
Yeah,
just take it. I'm over it. Well,
I'm
and
over it.
I think you brought up a really good point earlier, and I hadn't thought about this, but I think this is a great point. Let's say somebody is out there and they're on the fence and they're just like, they're nervous about outsourcing. It might be a good idea to at least attempt to outsource maybe some things that you feel are falling through the cracks, like if you're doing EKGs and all that, or labs.
Mhm.
Labs are really hard to keep track of in as far as in-house because they're small ticket items and not everyone understands that, or pathology, or diagnostics. I had one provider that it's a group of 5 physicians, and they only have one doctor that does the hospital services. And he's like, "Oh, those are so difficult because we're also relying on what the hospital does." And I'm like, "Why don't you outsource that?" And he's like, "Oh my gosh, we're finally making money on that provider." And I said, and so it's interesting you said that because I think that's a great idea to maybe do it like you said, hybrid.
Yes, hybrid can work because maybe they want to keep the current billing in-house and they just want us to, take over the old AR and get it cleaned up. Or
Yeah.
like you said, they could slice it out in different ways. I mean, just labs or just EKGs, et cetera.
Yeah. No, that's no, and I really liked that advice. That's helpful.
One major thing that makes us a little bit different than some other companies, we're not necessarily going in to take it all over. Our goal is to help them and come up with a customized approach that actually works for everyone. So
Well, and that's really helpful because for any of the staff that's also listening, I know we have a lot of providers and physicians that listen. We give advice and we give counsel and we give, consulting and all that to help you, not to take over necessarily, not to, yeah, not to, step on your staff's toes, but to add, value and benefit and to give you some peace of mind. Are things being done correctly? And it doesn't hurt to check in and look. So,
exactly. Maybe they've been burned by another outsourced company in the past and they don't want to take that risk again. So, that walk before we crawl, I mean, crawl before we walk, I got it backwards. Crawl before we
I knew what you
walk
meant. Yeah.
can sometimes be a good way to go as well. So,
Well, and I had a practice recently, and then I'll kind of wrap it up on this one, and I think you'll probably gasp. Orthopedic practice, and they were losing money left and right, and they said, "Can you take a look?" And I'm like, "Sure." So we took a look at it was their knee injections and joint injections and things like that. They basically they were told, and it's funny, it's like we were told, but they couldn't tell me who told them this. They didn't know. We were told. It's funny, there's this every practice has a black hole of somebody that told them something that we can't find. But they were told not to bill the medication that was built into the injection.
mm,
Oh yeah, Donna. I was like, what? So Symphysis injection is expensive. You've got,
yeah.
three different encounters for it, and it can be, over $500-600 for just the medicine. And you're only getting reimbursed about $350 for the injections, and you can't bill an office visit in addition because they're coming specifically for the injection. So they were losing 300 to 400 on every patient. And we went back a year and were able to capture a year, but that was going on for 3.5 years. And so things like that, I mean, just check in. If you feel that there's just something missing, and again, this to our listeners, This could be something that it does fall within outsource versus in-house, but even just check in to see that your revenue cycle is, healthy. And I guess that's the best way. We're in healthcare. Make sure that it's healthy. Donna can help you with that. Obviously, you've heard me. I help with that too. But it sounds like you have a team that's really on top of that. And so we appreciate your insights today.
Well, thank you so much. It was a pleasure to be on with you, Terry.
Great. So we'd like to thank Donna for being on our podcast today, and we appreciate her insight in this important topic in the business of medicine. You can find the contact information for Donna White at nschbc.org under the Find the Consultant tab. Type in her first name, Donna, D-O-N-N-A, and poof, there she is. As a reminder, the nschbc.org website offers free monthly webinars on a variety of topics, as well as a quarterly Medicare webinar update. For all educational offerings, go to the nschbc.org and click on Upcoming Education tab. Also check out our annual conference, which will be in Savannah, Georgia, June 4th through the 6th. That's it for me today, everyone. Please join me next month when we once again bring you current and important topics in the business of medicine. Everyone, make it a great day, a great rest of your month, and thank you for listening to the NSCHBC Edge podcast. I'm your host, Terry Fletcher.
Thank you for listening to the NSCHBC Edge podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.